We're in Malaysia and we're starting a 4-day training on infodemic management. WHO defines infodemic as an abundance of information that is circulating within the public domain, and it could be comprised of misinformation, disinformation, fake news, rumors, but also of accurate information. With COVID-19, we've learned the hard way how quickly rumors and misinformation can spread.
We're seeing that people have access to more information than they've ever had before. And that can cause real issues because people can become very overwhelmed and overloaded with information. And that can lead them to behaviours that are less useful.
We have gathered 50 participants from different divisions of the Ministry of Health, as well as colleagues from different ministries of Brunei Darussalam. And we brought all of them together to share knowledge, experiences, build capacities on how to effectively, in a systematic manner, implement infodemic management into public health and as a response to emergencies.
It is critically important to acquire the skills to manage the infodemic that spreads not only during pandemics and outbreaks, but also during the implementation of routine health programs.
We need to be able to address the concerns of the population, because ultimately when we talk about person-centered care, we need to seek to understand what it is the main concerns of the population at the moment. And I hope this training that is being conducted this week will become the first of many and will assist us in setting up a suitable curriculum moving forward.
This training we've been doing is important because it gives public health professionals the tools to be able to respond when there's next outbreak of public health emergencies and have strategies to be able to apply, quick research solutions to get quick insights to inform decision making.
Throughout the training, we really exposed the participants with some simple tools and resources that they can use in their day-to-day practices. But we also looked at some of the more complex issues and how to tackle them.
The training was absolutely amazing, well conducted by the team. What I would say that I got back was, in our organization, we have multiple stakeholders, and making sure that everybody realizes that we are actually saying the same message and bringing it all together and utilizing that abundance of information moves a step forward. And I think that's where this infodemic management comes into play.
This training has helped us to have a better perspective on a structure of how infodemic management can be conducted in a very systematic way.
If we do not tackle those misinformation and disinformation, it can also affect the effectiveness of our other public health measures, other public health response to the pandemic. And so it is important to have infodemic management systems in place.
Infodemic management is no longer the sole responsibility of health communicators or even just the ministry or WHO itself. We are all in this together.
Trainings like this that bring together behavioural insights and sciences together with the skills of infodemic management such as social listening and risk communication can be really powerful to give colleagues working across state departments and the Ministry of Health the skills that they need to tackle and prepare for emergencies, bringing together the different evidence and data that is needed to understand potentially harmful human behaviours that might result from the infodemic management and help improve and protect the public's health.
We can finally understand and value the importance of infodemic management. With the knowledge that we have, we will definitely try to implement it and strengthen it further.
We hope that with this training, we have inspired our colleagues from the Ministry of Health and our member states to think about risk communication, community engagement, social and behavioral sciences, and infodemic management as a very inclusive and systematic approach that can really strengthen our emergency preparedness, readiness, and response capacities and support better health outcomes in the countries.